Yeah. Hello and welcome to Seven Sentinels. This is Grand Master class and Peter Simon with you. Today we are conducting a marathon session. It means we don't know how long this session will go. It's a marathon session. So we have initially part A. We have 3 rounds of part A. Part A, first round is multiple choice questions. Yeah. And round B, round 2, is a short answer questions. Question number 8 to 13 questions. Then round 3, that is fill in the blanks, FITV, fill in the blanks. Questions 14 to 20. So altogether we are going to study different techniques. Okay. What I want to tell you is, yeah, I'll tell you something important here. Yeah. So these are HOTS. Okay. What do you mean by HOTS? Okay. What do you mean by this acronym? It is an acronym. What do you mean by acronym? Acronym means to consider it as a word, but it is a combination of words. Acronym means, yeah, what is an acronym? I told you it's a mega session now. Once again, don't bother your time. Don't bother anything if possible, because we are going to learn something very, very important. Now, what is an acronym? If you don't have time, that is not my problem, because I am giving you my time. That's good. You joined now. That's great. What's the name? The name is from Afghanistan, I suppose. Dr. Kabul, Afghanistan. Yeah, I have a number of doctors from Afghanistan. The name is Abdul Majid Azami. Very good, doctor. Welcome. Right. Acronym means abbreviation consisting of the first letters of each word in the name of something pronounced as a word. AIDS. AIDS is an acronym. AIDS is an acronym. A, acquired. I, immune. D, deficiency. S for syndrome. So that means 4 letters constitute one word, which means 4 words in all. In the same way, HOTS also, I have created this one when I was initially teaching my student teachers in a B.Ed college as a lecturer. We have 4 words here. First one is H, second one is O, third one is T, and fourth one is S. HOTS. So we have 4 words in all. Okay, 4 words in all. So now what do these stand for? I'll be doing many gimmicks, okay? Don't bother about all the gimmicks. Okay. H stands for, okay. Okay, H, higher. Then next, okay. O stands for order. These are not for everyone. Everyone cannot digest these things. Only extraordinary candidates like you can digest. Higher order thinking, okay, skills. Higher order thinking skills. Thinking. Higher order thinking skills. So HOTS means higher order thinking skills. Now, what do we understand by this higher order thinking skills? HOTS. Whenever I say HOTS, so you should think about all these things. Now, HOTS means higher order thinking skills. That's very clear now. Okay, that's very clear. So, what are these higher order thinking skills and how are we going to apply them? It's very, very important. Okay, so so that is it. Higher order thinking skills. Fine. Okay, now let's go to this higher order thinking skills in depth. Now, what are these higher order thinking skills? Now, let us see the HOTS. HOTS means higher order thinking skills. Remember those things. Now, they are 5 in number. They are 5 in number. Okay, these are, we can call them facts. So this facts is also an acronym. I have created this one again. So facts, F A C T and S. So facts. So what are these facts? Facts, F means F capital letter, focus. A stands for attention. C stands for concentration. Don't think all of them are same. Then why I'll give these things? Then next one is techniques. The next one is strategies. So focus, attention, concentration, techniques, and strategies, facts. So these are the higher order thinking skills. There are some more I'll tell later in the next part, in another section. So focus, attention, concentration, techniques, and strategies. So we are going to apply these things so that we can finish the answers very fast. We can grab the answers Just like that. Okay. Okay. Right. So if you miss anything afterwards, you can go through them. So focus, attention, concentration techniques. And what is the focus? What is your focus? Okay. Focus is the question. You have to focus on the question. You have to focus on the question. Notes. Make notes. Many people fail in reading. Why? Because they don't know why they are failing. They don't even know why they're failing. Right? So focus on the question. Attention on the minute details. Attention on the minute details. And concentrate on what the writer is focusing. Concentrate on what he wants you to understand, what he is expecting from you. Techniques, or I'll show you. These are skimming, scanning, and solving techniques, or you can say approaches. So techniques. So don't read everything, especially for part A. If you read everything, you are lost. If you go into a supermarket, you are lost because it's an ocean of goods, items, commodities. You'll get yourself lost the humongous commodities. And what you have to do is you have to focus on what you need. My problem is the focus. My question, I want these things. That is my problem. That is my focus. Okay? Right. Now, strategies. Strategies. So what? So time management is one strategy. Fast and furious reading is another strategy. Reading those things which are more important is another strategy. Okay. Techniques means how we have to approach. Strategies means how we can save ourselves from doing something wrong or deviating. Okay, fine. We are going to see all these things now. First, let us go to our Pyelonephritis part A reading. Now you see there are four texts. Text A, text B, text C, and text D. Again, text A. Here there is no title. Text B, investigations. Text C, presentation. Text D, management. So, now what is the title here? First question you have to ask. The first question that you have to ask, what is the title? Write down. The first question that you have to ask is, what is the title? What does the title tell us? What does the title tell us? Okay. Now you are my students and I am your trainer. You are my students. I'm going to address you regarding these above 4 points now. I'm going to tell you some points, some basic points. Now, what are these basic points? Let us see. So, first step, step 1. Okay, I'm teaching only the basics. I'm not going into the depth of the subject. Okay, that is reserved for the students who have registered with me, becoming my subscriber. Okay, topmost secrets are hidden from this session. Many things I will explain here. I'll explain 50% only here, but the remaining 50% I'll explain in my regular student session. So, if anybody is interested, you can get back to me. Right. For a regular training, personalized training. Those will not be open here. So, now let us see here. The step one. What is the step one question? You have to have four things. Number one, what does this title tell us? Why should we study this title? Study this title. How will it help us? Are there any other important things we can learn from it? So these are the four aspects you have to ask yourself when you are learning. So, what does this title tell us? What should we study? What should we study? Why should we study? Why should we study this title? And how will it help us? Are there any other important things we can learn from it? So these are the four areas that you have to understand. Okay? These are the four things that you have to ask yourself. The title. Okay, you have to focus on the title. Step one is the title. Yeah. So try to understand these four important things. What does this title tell us? Suppose if you ask your question like this, dear students, let's talk about today's title. It's Pyelonephritis. What is the title? Pyelonephritis. Now, what does this title tell us? This title tells us the entire passage is about pyelonephritis. The entire passage. That means the four texts, text A, text B, text C, and text D, and everything included. All the 20 questions is about pyelonephritis and nothing else. And this pyelonephritis is a medical condition. So what does this title tell us? It tells us that the entire passage is about pyelonephritis, and this pyelonephritis is a medical condition, specifically an infection of the kidneys. An infection of the kidneys. Pyelonephritis, kidneys. Pyelonephritis is an infection of the kidneys. So it sets the topic and it sets the focus for all the information in the reading. Now you are ready. You know what we are going to talk about, what we are going to study about, what is the topic about. Now, second question, why should we study this title? What's the reason? Why? We should study this title because it immediately gives us the subject matter. Now, you know, when you study the title, you will understand what is the subject matter we need to concentrate on. So we are concentrating on pyelonephritis, and when we know the title in advance, you know that title is given in the beginning only. Why it is given in the beginning? Because you have to know. If you don't know what the building is, and if you go inside and you find something else, and you will talk to the person, oh, I thought this is a bank. I'm sorry, I came to the post office. This is madness. Because you did not read the name board in the front of the post office. It is written there, post office. You wanted to go into a bank and you went into the post office because you did not read the name plate. How foolish it is. So now we can know the title in advance. We can predict, we can guess, we can imagine the kind of information we see. Now, pyelonephritis. So this is pyelonephritis. The topic is pyelonephritis. So what we will think of, there may be a background of pyelonephritis, there may be causes of pyelonephritis, there may be symptoms of pyelonephritis, there may be diagnosis of pyelonephritis, there may be treatment of pyelonephritis, there may be complications of pyelonephritis. There may be different areas. So we have 4 different areas. Text A, text B, text C, and text E may be one of these. So it primes, it makes our mind, our brain, to look for relevant details. So it makes us, it trims us, it polishes us, it primes us, or it figures out our brain and makes it look for relevant or necessary details, important details. Now, how will this title help us? How is it going to help us? In what way it's going to guide us? It will help us by narrowing our focus. So, if we see that it is pyelonephritis, then we'll understand it immediately now. What? That means we are not going to study about brain tumor. We are not going to study about, what is this? Digestive problems. We are not going to study about cancer. We are not going. So, there are a number of topics, there are a number of things, but we are limited. That means we have a boundary, we have a scope. We will not go beyond pyelonephritis. That means kidneys, infections, kidney infection. That's all. So this is how we are going to do. And now next one. Any other important? So we are going, instead of reading blindly, so it narrows our focus and it makes our reading faster. Our reading becomes faster and more targeted, target-oriented. That means we limit to, oh, this is important, so we'll go there only. Whatever we need. For example, if you have a list, you'll go to the supermarket and buy those things. If you don't have a list, so your focus will be distracted. You will see everywhere. You don't know what to buy. You don't even know why you came. So like that it will be. So this improves our scanning and skimming skills, which are vital for OET reading part A, where time is limited. Now, are there any other important things that we can learn from it? Yes, the titles helps us activate our prior knowledge. If you already know something about kidney infections, you can anticipate words like urinalysis, antibiotics, scarring, sepsis. So you know already that this is about kidney infections. So now you can think about these words. You can guess, your mind is ready, tuned. For example, if you know that you are going on the road, highway, then you will guess what you are expecting there. So like that. So urinalysis, antibiotics, then scarring, sepsis, such things. These things, this makes comprehension easier. Also, understanding the title teaches us a key test strategy. Always read the title first to get a mental map of what is going to come. So mental mapping. So, dear students, remember, every time you see the title, don't ignore it. Use it as your first clue, your first weapon in tackling the test. Now, next, step number 2. Step number 2. Step number 2 is the subtitles. Subtitles. Now, subtitles, if you see here, so now if you see here, what does this tell you? Definition. So text A, what are the suggested subtitles you can think of for each of the 4 subtests? So here you can see the first one is the definition. What is acute pyelonephritis? So this is the definition. You can see that this is the definition. I'm going to, if you understand like this, you will not miss even one question very fast. So if you do like this for 3 or 4 days or at least 1 week, it will be very easy for you to grab the answers very fast. Afterwards, you don't need time. For initially, you need some time to understand how we are doing. So this is definition, or you can say epidemiology. Okay, definition and epidemiology. So this, you see here, focus on what pyelonephritis is. This text A is telling what is pyelonephritis. So in the first paragraph, you see, acute pyelonephritis is an infection. So try to understand, it is an infection. So what is pyelonephritis? That means it is a definition. It is a definition. And it tells how it happens and who is affected. You see there. How it happens, because of the functioning part of the kidney, something is there, you can see. And who is affected, who is most affected there, you can see. Boys, girls, uncommon in men. See here, older people. So 1% of boys, 3% of girls. And highest in women, aged 15 to 29. And then infants and older people. But this is not common in men. It is uncommon in men. So mostly in the women. Uncommon, rarely in men. Common in women. Okay. Common in women aged 15 to 29. And then infants and older people. Infants, small kids. And older people, aged people, above 50 or 60, you can say. And men, it's uncommon, means rare. So you understand now who is affected by this. Over the age of 65, the incidence in men rises to match that of women. Above 65 men, it rises. But middle-aged men, no. Above 65, men rises and meets equal to women. That's what he's telling. So, how it happens, the procedure or the process of getting this problem, medical condition. So, what is pyelonephritis? How a person is infected and who is infected? So, all these things are there in this one. So, it is definition and epidemiology, we can say. So, we can give this title, definition and epidemiology. Okay. So, definition, or you can say epidemiology. So you can give this title for this. Definition, meaning, background, lot of synonyms you can take. That we'll think about those later. Next, second one. Now, what is the title you can give to the second one? Okay, many of you don't know. That's why you're failing number of times. It doesn't mean that you have to fail again. Okay, if you learn properly, right, then it will be very, very easy for you. So now this is about investigations and diagnostic tools. Investigations and diagnostic tools: scan, MRI, culture, sonography, urinalysis. So it is investigations and diagnostic tools. Now covers urinalysis, imaging, scans. How to confirm the diagnosis? So how to confirm the diagnosis? So it is diagnostic tools, so diagnosis, investigation. Okay, so you can give the title for this one as investigation and diagnostic tools. Yeah. Investigations. Investigations, or you can say diagnostic. So you have to create like this: tools, investigations or diagnostic tools. Diagnosis is done accordingly. You can see here. Okay. Investigation or diagnostic tools. Right. What are the investigations there? You can see urinalysis, blood cultures, ultrasonography, CT scan, MRI, inflammatory markers, signs and symptoms, and diagnosis. Okay, investigation, preliminary investigation, definitive diagnosis, all are there in this. So you can label this as investigations and diagnostic tools. Remember that. Next one. Now C, text C. What do you see here? Presentation. Presentation. Now here, in this presentation, you can see first paragraph, it is onset. Onset. Onset means it is showing some symptoms. You can see there symptoms. Malaise, nausea, vomiting, anorexia, and occasionally diarrhea occur. So these are signs and symptoms. In the second line, you can see. So when these symptoms are there, unilateral, bilateral loin pain, suprapubic pain or back pain, okay, rigors, and many other things are there. Okay, these there may be or may not be, there may be or may not be accompanying lower urinary tract symptoms. Symptoms. The word symptoms has come there. Okay, the word symptoms has come there. Yeah, Sandeep Kaur, don't miss. Very important because you requested me. Okay, see, I thought you are not there, so I took A today. Right? So, fine, no problem. Now, here you can get 20 out of 20 in this part A if you follow these techniques. So, only 10 more. Okay, only 10 more. So, 4 from part B and 6 from part C, enough. Very easy if you score 20 out of 20. It's very, very dead easy if you follow this system. So here, these are symptoms. First, he gave symptoms. See, in the beginning, it's onset is usually rapid with symptoms. Symptoms. The fifth or sixth word is symptoms. And then he gave the symptoms there. Loin pain, suprapubic pain, back pain, rigors, malaise, nausea, vomiting, anorexia, and occasional diarrhea. All these are symptoms. This may or may not be accompanying lower urinary tract symptoms. Again, symptoms. So you can see these are present everywhere. Symptoms. So you can say these are symptoms or clinical features and differential diagnosis. Common differential diagnosis may include cystitis, ectopic pregnancy, ovarian torsion, ruptured ovarian cyst, rib fracture, STDs, renal stone, benign prostatic hyperplasia. Differential symptoms, differential diagnosis. So now, clinical features and differential diagnosis. So first part is about symptoms and last part is about differential diagnosis. So two things are there here. So here you can give the title for this one as a clinical symptoms and differential diagnosis. If you do like this, answers will be very easy for you now. So these are clinical presentation to the clinic. So clinical features and then differential diagnosis. Differential diagnosis. Okay, so that's it. Right. Clinical features and differential diagnosis. Now we have got three labels. The first one is definition and epidemiology. The second one is investigations and diagnostic tools. Third one is clinical features and differential diagnosis. And then the fourth one, you see, what is the fourth one here? Now management. And next one, hospital admission treatment. Management and treatment. Ayesha Chaturani, very good. So, management. So you can see there, this is about management. And next one, guidelines are there. There are some procedures, guidelines, suggestions. So, hospital admission, how to manage. And for this many years old, this you have to do. For this adults, you have to do this one. For children, you have to do this one. This is the dose, this is the duration, this is the notes, what you have to do, what. So directions, or you can say guidelines. This is treatment, management and treatment. Management and treatment guidelines, you can say here. Management and treatment guidelines. So it is management and treatment guidelines. We can take like this. Yeah. Management and treatment guidelines. Fine. We can take this title as it is. Okay. Let us take this title as it is. Management above and treatment guidelines below. Okay. Yeah. So management and treatment guidelines. Now we have got 4 titles. Now let us see what are the titles. Now step 2, the subtitles. Okay. We have got the 4 subtitles. So subtitles for text A, text B, text C, and text D. So now let us bring out step 3 now. So title. What is the title? Pyelonephritis. We have come to the point now. Pyelonephritis. This is the title. Now next one, text A. What is text A? You remember now. Text A, yeah. Text A is definition and epidemiology. That is text A. Then next, text B is investigations and diagnostic tools. Text C, clinical features and differential diagnosis. Okay. Next, text D is management and treatment guidelines. Now, these are the titles and subtitles. Okay. These are the titles and subtitles. Okay, fine. Right. These are the titles and subtitles. Definition and epidemiology, investigations and diagnostic tools, clinical features and differential diagnosis. Now try to understand this, how easy we are going to get the answers now. Now this is a very big name, very big, very big. So now what we can do is, we can take one word. Come on, write down. What can we say for A? Write down one word. Okay. What can we say for one word for? So this you can say definition. Then next one, investigations. Next one, we can say symptoms. Symptoms. Okay, signs and symptoms. Okay, because everywhere it is symptoms. We can give symptoms. So one final word we can take here. And this one we can say management. Okay. Now we got 4 words now. So let us take one word substitute now. For this one, we'll take just one word now. Yeah, we'll take one word itself. What is the one word? Definition. So we are taking one word, that is definition. And for this one, we are taking one word, that is investigations. Okay. Yeah. We can take one word here, investigations. Yeah. There are many other words you can say. Okay, investigations. Then next one, that's the third one, you can say symptoms. You can use the word, one word, symptoms for this one. Okay, easy word, which will help you for the answer. We can say symptoms. Next, for D, we can take, the management is already there. The same thing we'll take now. Management. Right. We took the word management. Okay. Now coming to the point, we'll cut it short, the lengthy one. Okay. Pyelonephritis. First one, definition. Then second one is investigation. Third one, we can say all this into one word, that is symptoms. Fourth one, we can take one word, that is, yeah, fine. This is how we are going to get. So we have got the 4 words. Now, I'm changing the style here a little bit. Yeah. So, Don't panic, don't worry, don't be tensed, don't be upset. Bear with me because I'm going to teach you something which will help you a lot. Yeah. So you've got something like this now. Yes, pyelonephritis is the title, and then these are the subtitles. So now we are going to have our question. We are going to have our question. Yeah, this will be our question area. This will be our question area. Bear with me. Only first title, it will take a little time. Afterwards, it will be okay. This is question. Okay. Now, this is the question. Right. So what does the question say here? Let us see. The question says, in which text can you find information about? So, in which text can you find information about? Okay. This is not very important. So I'm putting it in black. Not important. Not important. And everything I'm sharing it. Only the important things I'll open it up for you. So this one, I'll share it with the light dark gray. Yeah. So this, only the important things I'm putting in white. So these are important, A, B, C, D. So this is A, and this is B, and this is C, and this is D. So we have all these four things which are very, very important. Yeah. So these are very important. Only the white areas, those are very important. See, in white shade, black letters, those are very important. This is not important. This is not important at all because this is common. Pyelonephritis is also is common. This is also not very important. Okay. So now what is important will come in the center. Yes. This is very important. So I'll give you in the white color. Yeah. So this is very important. This is very important, right? So now let us see here. What is our first question? The first question. Okay. Right. So this is question. Yeah. So question will be in the center. Okay. Right. Now here we go to our 7 questions. I'm just giving everything, no need other things for us. Okay. Yes. Now here you have 7 questions. Here you have 7 questions. Let me take it a little up. Yeah, that's it. Okay. Right. Very good, Sandeep. Wait. Okay. Now here we have the questions. A is a definition. Yeah. A is the definition, B is investigation, C is symptoms, D is management. Now, first one is the definition, second one is investigation, C is the symptoms, D is management. Now think about and you write your answers in your notebook. Write your answers in your notebook. You take your time and write your answers in your notebook. Come on. Yeah. Now here you have to remember the alternative subtitles, for example, for A, definition and epidemiology or a definition. So definition and epidemiology. Alternative is overview and incidence, and synonyms, maybe nature and frequency, nature, background and frequency. And then parallel, maybe description and prevalence. So like this, there may be any, they may given any way. Next, B, investigations and diagnostic tools. So investigations, alternative, you can say tests, imaging, or diagnostic workup, or examinations and confirmation. So examinations and confirmations. So diagnostic tools means confirmations. So like that you can say. For C, symptoms, clinical features and diagnosis means signs, symptoms, signs and symptoms. Then you can say possible conditions, or you can say symptoms and ruling out, or presentations and exclusions. So symptoms and differential diagnosis, or clinical features and differential diagnosis, and signs and other possible conditions, symptoms and rule outs, or presentation and exclusions. Anything it may be. Don't think it's the same word. Any other word may be in the question. So next one, management and treatment guidelines. Management and treatment guidelines. Then next one, you can say care and therapy. Management means care, or therapy plan, or treatment approach, or handling and medication. All these things will go into one thing. Now let us see on what grounds do you think that these subtitles are suitable. These subtitles are suitable because they summarize the content of each section clearly. They tell us exactly what type of information we will and find there. By using symptoms, synonyms, or parallels, we adapted to different ways of thinking about the same content, making it easier to remember. So what can you learn from these subtitles? We learn structure and organization now. And instead of facing a big block of text blindly, we can break into subtitles, which break into manageable chunks. They help us predict questions, locate answers quickly, and improve our skimming and scanning skills for the OET exam. So, any other important aspects you can learn about them? Yes. Subtitles also help you activate your professional knowledge. When you see investigations, you think of test, you think of scans, you think of urinalysis. When you see management, you think of medicines, you think of admission criteria. So this approach connects your medical training to the reading test, making you a faster and more accurate reader under exam conditions. So dear students, always remember one thing: creating or recognizing subtitles is a key strategy. First titles, then subtitles is a key strategy. It turns a long test into a clear roadmap. Use this skill in every part A test to save time and increase accuracy. Now let us see. These questions are grouped into 3 types. So 1 to 7 is matching test, 8 to 13 short answer questions, and 14 to 20 sentence completion tests or fill in the blanks. Now let us see how to do it. Now this one, scanning is enough for this one. Just a scanning. No need to do many things. Skimming and scanning. That's enough. Skimming and scanning. Which section it is? Skimming means just find the subtitles. That's enough. Scanning means go to that area. Find out. Now let us see. What are the words which help us? What are the words that are going to help us here? Okay. Aisha, very good. Don't miss the session, okay? Right. So now, if you see very clearly, what are the words that are going to help you here? That is very, very important. Now, the advantages of different types of examinations. This is the key word here. Examinations. Pyelonephritis is the title, we know that. Advantages of different types of examinations. Okay, examinations means types only. More than one examination, different types. So you can understand where it will go. Next one, symptoms. Next one is symptoms that may indicate a patient with pyelonephritis needs inpatient care. Symptoms. Symptoms. You can try to understand here like this. Okay, symptoms that may indicate a patient with pyelonephritis needs inpatient care. So this will go into symptoms or this will go into care. Symptoms that may indicate a patient with pyelonephritis needs inpatient care. Inpatient care. So try to understand here. So is it symptoms or care? Which is the most important? Symptoms that may indicate a patient with, so these are not just symptoms, these are indicating that the patient needs care. That means what you have to do, you have to just lead in the symptoms or you have to go for management. Is it C or D? So try to understand this. Is it just stopping in symptoms or it is taking you to management? So you have to think like this. Next one, okay, conditions. So symptoms are indicating, indicators, signs, suggestions, symptoms, signs and symptoms, indications. Okay. Next one, conditions for which pyelonephritis may be mistaken. Conditions means symptoms. Again, conditions means symptoms for which pyelonephritis may be mistaken, misunderstood. Means a differential, maybe. So differential, maybe what it is. Okay. Next one, where in kidneys pyelonephritis occurs. This is occurring. Occurring. Where it occurs. Where in the kidneys pyelonephritis occurs. Means occurrence. Where exactly? Where it is happening. Is it in investigation or symptoms or management or definition and details? Background. So, a problem with diagnosing the pyelonephritis in younger patients. Okay, now see there. Problem with diagnosing. This is diagnosis. Okay. This is diagnosis. Fifth one is diagnosis. Diagnosis means what? Diagnosing. So problem with diagnosing pyelonephritis in younger patients. So what is the problem to diagnose? So is it going into investigations or is it going to symptoms? There is a little confusion, but you have to see. So a problem is there, right? A problem is there. You cannot diagnose pyelonephritis because it may show something else maybe. Okay. So is it an investigation of pyelonephritis or is it something leading to differential diagnosis of something else? Maybe B or maybe C. Think about like that. The health consequences of recurrent pyelonephritis in an individual. The health consequences. Consequences means what? The health consequences. Sixth one. The health consequence impact. Okay. The health consequences impact. Is it talking about the background? That is definition or investigation or symptoms or management. Okay. Recurrent pyelonephritis in an individual. So consequences will be in investigation, or consequences will be in symptoms, or consequences will be in management, or consequences will be in the general background. So the length of time that pyelonephritis medications needs to be taken off. The length of time that pyelonephritis medications need to be taken for. The length of time. Pyelonephritis is diagnosed, already diagnosed. So we are taking medications. How long you have to take? Will it be in definition? Investigation means you don't know whether it is pyelonephritis or not now. So you are just doing investigation. Symptoms are not sure again. So diagnosis is already done here in the seventh question. So is it definition or management? Where you will find this answer? Like you have to find out that particular word which is going to help you. Okay. Condition mistaken means differential diagnosis. Okay. Mistaken, misunderstood. So instead of diagnosing something, you have diagnosed something else. So differential diagnosis maybe. So you have to understand the relationship. Now, I hope you understand something. Okay, Aisha, no problem. Right. So now let us see the advantages of different types of examinations. Now let us see this one. Question number 1. The key phrase lists advantages. Advantages. Okay. Understand the question. There. Right. Then activate your medical knowledge. For example, the key phrase. There may be some key phrases. So these key phrases, advantages means benefits. Advantages means benefits. The advantages of different types of examinations were advantages. For example, advantages of you say ultrasonography, advantages of CT scan, or advantages of MRI, or benefits or advantages. So there will be a list of advantages maybe if you go there. So different types of examinations. Examinations means investigations. You see here. Examinations. You're examining means you're investigating. You're checking. You're examining. You're finding. You're analyzing. You're discovering. You're researching. You're studying the patient. So these are all synonyms. Write down. Examining, studying, researching, discovering, finding, checking. All these are synonyms. Okay. So examination means investigation. So it will lead you to be. It will lead you to be. So now it's very clear. Yeah. Yeah. The answer you can see is B. Right? Next one. So let us think like that one. This is B. Next one. Symptoms that may indicate a patient with pyelonephritis needs inpatient care. So symptoms. Now let us see very clearly here. So investigate for the first question, investigations and diagnostic tools. Now let us go there and find out this particular question, how we are going to understand the question. Then step 2 is activate our medical knowledge, imaging investigations. For example, you can say investigations, diagnostics tools. Then next one, recall our subtitles, definition, investigations, clinical features, management. So imaging tests, which one screams imaging tests? Imaging tests, you can see there. So it will go to investigations and diagnostic tools. Okay, now let us see step 4. You can go to the text and you can see there and you can find out the correct answer. Now let us go to so quickly locating the right test, you have to skim and scan. You have to skim and scan. Right. Next, question number 2. Now, list of indications. Symptoms that may indicate a patient with pyelonephritis needs in patient care. Okay, try to understand. Patient care means the patient, sending a patient to the hospital, admission. Sending a patient to the hospital for admission. Symptoms that may indicate a patient with pyelonephritis needs inpatient care. Inpatient means admission. Admission to the hospital. So investigation, symptoms, management, definition. So inpatient care, care means management. Inpatient means admission. After admission, management, that is care. Okay. Only after investigation, you will say he needs admission. If you don't investigate, you will not say anything there. Okay. Yeah, very good. Saga, what's the name? Gayatri, Sandeep, Azami. Okay, right. Now let us see here. So, symptoms that may indicate, already symptoms are there and you are diagnosing there. It is indicating. Signs and symptoms suggest that he needs inpatient care. That means you are sending him to be managed. Care. You are taking care. That means you are managing him. You are admitting him, inpatient, admit, and care, management, admission and management. So in the hospital, try to understand that one. So you are sending him for hospital admission. That's how you have to think. Then here, we typically see admission criteria and clinical notes. Now management or treatment guidance, you can see there. Okay, next. Yeah, here we have to write the answer. So what might be the answer? D. D might be the answer. Let us suppose that D is the answer. Okay. Care, inpatient care. That means care means management. Management in the hospital. Okay. Inpatient care, management in the hospital. Conditions for which pyelonephritis may be mistaken. Conditions for which pyelonephritis may be mistaken, misdiagnosed. So differential diagnosis. Okay. Differential diagnosis maybe. So conditions mistaken. It may be mistaken. It will show you to differential diagnosis. Differential diagnosis. Very good participation. Good participation. So mistaken means a different. Mistake. The wrong diagnosis. Differential diagnosis. Misdiagnosis. Mistaken diagnosis. Okay. Pyelonephritis, instead of diagnosing pyelonephritis, diagnose something else. Maybe there are many other reasons which, because of these symptoms, make indicate some other disease also. So mistaken differential diagnosis. So mistaken differential diagnosis. So this will show to symptoms. Maybe. Okay. Conditions means symptoms. Conditions means symptoms. Conditions, mistaken conditions. Symptoms, wrong symptoms. Wrong symptoms. Conditions means symptoms. Conditions means symptoms. So we can straight away take conditions. Conditions means symptoms. Mistaken means wrong symptoms, means differential diagnosis. You can understand that one there. Wherein the kidney pyelonephritis occurs. Where does it occur? Pyelonephritis, where does it occur? So is it in investigations? Where does it occur? It's general information maybe. Is it in symptoms? Is it in management? Okay. Is it in symptoms or is it in management? So occurs, this is pyelonephritis occurs in the kidneys. Where exactly? So it is general information. Where it happens? It's not in investigation. It's general information. Where kidney pyelonephritis occurs. This is no way in relation with investigation. There is no way in relation with the symptoms. There is no way in relation with management. Management is after discovering. Okay. So no need investigation, no need symptoms, no need diagnosis. It's direct general information where it happens. You have to have an idea, background information. So that's it. It's general information. Okay. Or background, we can say where it happens, who gets this, how they get, which people get these things, how they get, what is pyelonephritis, where it occurs, where it happens, how it happens, who gets this one, who is more affected. All these things are there in general information. That is definition, background information, basic information. Even if you don't get pyelonephritis also, you can know that one. That's not a problem. It doesn't need that you have to get this one to have this knowledge. General information. So you have to understand like that. A problem with the diagnosing pyelonephritis in younger patients. So diagnosing a problem to diagnose is difficult to diagnose. So fifth one, it is difficult to diagnose. So diagnose. Why it is difficult to diagnose? Because there is a problem. So you are not able to diagnose properly. You are diagnosing incorrectly. Because of the problem, you are not able to diagnose properly. You are not able to diagnose correctly. So there is a problem, mistaken problem. So already it is there in 3. You can see there in the same type problem, maybe mistaken condition because of some symptoms. Okay, because of certain reasons, a problem with diagnosing pyelonephritis in younger patients. In younger patients means maybe children or infants. Okay, or young people, maybe adolescents. So younger patients, not middle-aged people or old-age people. Younger people, young people or students or children or infants. So you can take these things. It may be boys or girls, whatever it is. So a problem with diagnosing pyelonephritis in younger patients. What is that problem? Why are you not able to diagnose? Because there is a problem. Not able to diagnose means not diagnosed. That means wrongly diagnosed or undiagnosed or wrongly diagnosed. So misdiagnosed. Not diagnosed is misdiagnosed only. Na? You missed to diagnose. You missed to diagnose it properly. Means misdiagnosed only. So because of certain symptoms, because of certain conditions, you can say. So this diagnosing a problem because you are not able to diagnose problem. This may be related to symptoms. Okay. Some symptoms are not showing accurately. So you are not able to diagnose. The symptoms are not clear. So you are not able to diagnose. If the symptoms are clear, then you can diagnose. That means you can investigate, you can examine, and you can have a definitive diagnosis. So definitive diagnosis is not there. So definitive diagnosis is not there means not diagnosed. Not diagnosed means undiagnosed. Undiagnosed means misdiagnosed. Wrong. Finished. Misdiagnosis means differential diagnosis. That's it. So these are all related things. So you have to understand. Diagnose. Problem with diagnosing means not a diagnosed. Not a diagnosed. Means pyelonephritis is pyelonephritis. You cannot say it is pyelonephritis. Means wrongly diagnosed. Even though it is okay, you are not able to diagnose it. That means misdiagnosed. That means differential diagnosis, wrong diagnosis, whatever you can say. So this is the way how your relatable understanding, relatable study, you can say. So for this, you don't need to go through everything, right? Next one. Third one, what was the answer? Third one was miss conditions. Third one was C, right? Okay, C. Yeah. Next one, fourth one occurs A. Next, fifth one, we thought C, right? Yeah. You cannot become a master overnight. You have to learn the techniques. That's all. If you learn the techniques, one day you maintain, take this hard work and do this hard work, and everything will be easy afterwards. Tomorrow only it will not be easy. You have to practice at least for 3-4 days. Okay, if it is for 1 week, you'll become excellent. But do it daily. The health consequences of recurrent pyelonephritis in an individual. The health consequences of recurrent pyelonephritis in an individual. Consequences means results, end results. So will it be an investigation? Investigation is to find out whether he is pyelonephritic or not. Symptoms are related to pyelonephritis only when it is their management. But these consequences of pyelonephritic individual, recurrent again and again it is coming. So what are the consequences? What happens? That will be not in investigations. Okay, investigations you will find only recurrent pyelonephritis, but what consequences you will not find in investigations. In symptoms, just you know the symptoms. In management, you will just management. But recurrent pyelonephritis, what are the consequences? That is general information again. Okay, that is again general information. So consequences will not be in investigation. In investigation, you'll find the symptoms. Okay, you'll find, you'll discover something. You'll come to a preliminary diagnosis or a definitive diagnosis. Then symptoms. Symptoms are signs and symptoms. How the conditions are. That is conditions only. Management is if these symptoms are there, this will be diagnosed. Symptoms are there, C. This will be diagnosed, B, and it will be managed, D. And it is managing again and again and again, it will be A again. So consequences of multiple. So management means how you are going to manage that. So you have these symptoms. So you have this investigated diagnosis. Then you are managing management. That's it. These are the symptoms. So you have investigated and diagnosed. So you are managing. So pyelonephritis symptoms. When you have symptoms, you go to the doctor. Doctor will investigate. After investigating, he will diagnose. So diagnose management. He'll send you for management. So management, you are treating for that problem. But this is recurrent pyelonephritis, not 1 time, 2 times, 3 times. After many times this is happening, that is recurrent. So that will not be in management, that will not be in symptoms, that will not be in investigation. This is consequences that will go into A again. Consequences means after effects. Yeah. Next. 7th question. The length of time that pyelonephritis medications need to be taken. Medications, will there be in definition? Medications, will they be in investigations? Medications, will they be in symptoms? Medications will be there in management. So after diagnosing only, you will give medications. That means you are going to manage the condition, right? Huh? What do you think about this? Am I talking sense or nonsense? You have to tell me. I don't know whether I'm talking sense. This is all pure logic. You have to tell me whether I'm talking sense or nonsense. So this might be D. This might be D. Now let us see. So first one, we have thought it is B. Second one, we thought it is D. Third one, we thought it is C. Fourth one, we thought it is A. Fifth one, we thought it is C. Sixth one, we got the answer A. Seventh one, we got the answer D. Now let us check whether we are going to get the correct answer or not. Okay. Now these are the 7 answers we got. Now let us check. Okay. Now let us check these answers. Yeah. Now oh. Now let us check these answers now. So first one is B. And first one is B. Okay. First one is B. Next one, B, D, C, A, C. Okay. Next one, second one is a D. Second one is a D. Third one is C. Fourth one is A. Fifth one is C. Sixth one is A. Seventh one is a D. So you can see very clearly now. So 2 and is a D. 3 C. 4 A. 5 C. 6 A. 7 D. So this is what? So you got the first answer. Now let us evaluate. First one is right. Second one D is right. Third one C is right. Fourth one A is right. Fifth one C is right. Sixth one A is right. And seventh one D is right. So you can message me how many marks you got now. You got out of 7. Out of 7, how many marks you got? Yes, please. Out of 7, how many marks you got? You can message there. Gayatri got 6. Very good. Gayatri, you are going for the exam, you said, right? So you contact me afterwards because those who are going for the exam next month, I'm giving special program. So Sandeep Kaur is also joining for this special program. Okay. If you are really serious and you are really dedicated, then I'll give you my personal session. This is only for general sessions for the general people if anybody is interested. So that will be personal, that will be even in depth. Okay. So here I'm giving in a general way so that everyone can understand. That will get even more shortcuts. Okay. Because we have limited time. Yeah. Next, who else? Azami, Dr. Azami. How many marks you got? Yeah, Lavanya. Lavanya is there. She said, I cannot attend, but still she's attending. Very good girl. Azami got 5 out of 7. Yeah. Now I am unmuting your phones. Yeah, it is already unmuted. You can share your experience. Dr. Azami from Afghanistan. Yeah, you can unmute and you can speak. How was this session beneficial for you? Dr. Azami, if you are comfortable, you can share your experience. Yeah. Yes. No problem. Oh, something problem with my video. Okay. Right, no worries. Okay, no problem. You can just type your message here. Then Sandeep Kaur. You can type your message, or if you want, okay, you can unmute and you can speak how you felt regarding the session. If I knew that you would be there, I would have taken C. Right. See, we can do tomorrow. Yes, please. So, Dr. Azami, you can send a message to me personally. No worries. Yeah. Lavanya. Lavanya is bold. Come on, Lavanya, you can share your experience if you want.
Yes, sir. I joined 5 minutes before only, but
Oh,
I
very
got
sad, very
some
sad. No
idea.
problem. I
Yeah,
have saved
I
it for
got
you.
an idea that actually,
I'll
like,
send the
we have.
link. You ask me, no problem.
Yeah, yeah. I'll just watch completely in the YouTube
Yeah,
also.
I'll be giving many sessions morning, sometimes afternoon, sometimes many sessions I'll be giving. Whoever will be available, whatever time you can attend. If you
Hmm.
miss, so you can ask me. I will arrange that.
Yeah, sure.
And
Yeah.
whenever you are in my personal session, whenever you are available, you can attend
Yes.
the classes also. No problem.
Yes, sir. Yes, sir. Sure, sure, sure,
You can
sure.
always ask me. If you
Yeah.
ask me, I will arrange.
Yes, sir. Sure.
Okay.
Yeah.
Right. Yeah. Next, Gayatri. Hello, Gayatri. Yeah. Amazing class. And the technique is really effective. Difficulty main with part C. No problem. Don't worry. So that part C I will give individually only, mostly to our regular students. So no need to worry. Yeah. Anyhow, you are joining, so no problem. You can take the schedule from tomorrow. I'll confirm your admission tonight. Yeah. Next, Gayatri. Hello, can you speak, Gayatri? Hello. Oh, you are on duty. Okay, no problem, dear. You can message me. No worries. Okay, Sandeep, do you want to speak anything, or do you? Okay, we can speak personally. No problem. If you are available, if you're comfortable, you can unmute and you can speak. Otherwise, we can speak later. Okay. So now that's the first round of questions. You can go. The same technique you can apply and you can learn it very fast. Without seeing, you can. Okay. No problem, Sandeep. No worry. Okay. So we can see the next round later. See you all. Have a nice day. Bye bye.